Welcome to the Breech Birth Podcast. I'm Sasha Hopkins, private midwife, breech birth educator, and your host. This is a space to hear the real, raw, and powerful stories of women who have experienced breech birth in all its layers. Each episode features honest conversations with women who've experienced breech firsthand, offering insight and reflection. This podcast was born from the knowing that these stories need to be heard, to inform, connect, and reclaim the story of breech birth. Whether you're navigating breech birth yourself, supporting others, or simply curious, welcome and thank you. Hi, Bree. Welcome to the podcast.
Hey, Sasha. Thanks for having me.
So give our listeners some context. Can you tell me what year your baby was born?
Yeah, so my daughter Isla was born in 2024, last year in August.
And where were you located at the time?
We are in Sunshine Coast. The nice sunny part of Australia.
Beautiful. And what kind of care did you receive during your pregnancy, birth and postpartum?
So I had a few different models of care, I suppose. So we had our private health insurance already covered. I thought we were going to go down that route, but I did a lot of research during our trying to conceive journey. So it's about a year and a half in total that I was able to research and told me what avenue I wanted to go down. We first went to a private midwife.
Mm-hmm.
Didn't feel like we aligned with them so much. I just knew in my heart that I just didn't really feel comfortable with them. I thought, no, there's probably better options for us. Having a bicornuate uterus, I just knew that I wanted someone that could be able to deliver our baby at home if they were breech. So we kind of had one appointment with them, didn't really want to go back to them. And then we went to a private group practice, had a few sessions with that midwife that we were assigned with, but I just still didn't feel in my heart that it was right. And I kept asking questions like, would you be able to help me deliver my baby at home if they were sitting breech? And they weren't able to give me a clear-cut answer. So we decided to get another opinion from an obstetrician, a private obstetrician that was supposedly meant to be high-risk obstetrician. But all I could get from him was that we just want a safe mum and safe baby at the end of the day. So he just couldn't give me a clear answer again. So around 22 or 20 weeks, we found a private midwife that was trained in breech birth, specifically at home birth midwife. And yeah, we aligned straight away and we felt so comfortable with her and how she would believe that I would be able to deliver my baby at home being breech.
So you had 4 different potentials by the sounds of that. Yeah, wow.
So it was knocking all these people away. I mean, it was easy for me to knock them away, but before we found our private midwife, I just don't know if I believed that I could do it at home. I was like, no, there's got to be more options. I know there's, watching the Born at Home film, that kind of cemented our wanting to be at home. But I think I just knew in my heart that there was another option that I hadn't found yet, but we were able to align with this new private midwife that, gave us everything that we could have asked for.
Great. And how many weeks were you when you birthed your baby?
I was 41 and 5. So yeah, it was a bit to my surprise because all of the outside noise telling me that I'd probably be birthing my baby at 36 weeks or earlier. So each week that ticked by after 36 weeks, I was like, okay, this is awesome. Like my body's doing what it's meant to be doing, and I really trusted my body. And my private midwife really helped me to believe in myself, and she believed in me too. So.
Yeah, great. And did you have a vaginal birth or a cesarean?
Yes, so vaginal breech birth at home. So it was, like I said, everything that I could have asked for. I guess not everything goes to plan, like they say, but it was everything that I had wanted. I knew that I wasn't medically necessary for me to have a cesarean, being my pregnancy was smooth sailing right from the start.
Yeah, beautiful. And before we jump into the story, do you want to share just a little bit of background to give our listeners an idea of who you are?
Yeah, so I am Bree. I live on the Sunshine Coast with my partner Sam and my daughter Isla and our dog Harley. We moved up to the Sunshine Coast maybe 2 years ago from Melbourne. We didn't know anyone up here. Yeah, we didn't know any friends, didn't have any family. So we had to start basically from fresh again, but it was great. We built a really great community up here, especially in the home birth community and the holistic environment that we live in. And so we trying to conceive journey started maybe a year and a half before we started pregnant with Isla. So we did a lot of testing. I had a lot of testing because I was having painful periods right from the start. And then I did a laparoscopy. I found a bicornuate uterus. and also endometriosis. But yeah, to my surprise, that bicornuate uterus was, a shock to me. I had no idea what that was. I'd listened to other podcasts about it, but never knew that was something that I would probably go through. So yeah, that was quite, I guess, scary at the time. So dove into the research, bad and good. I guess all the ones that would tell me you probably won't be able to have a baby, or even a healthy baby, right down to having a cesarean. But I just knew that it wasn't my fate. So anyway, we were trying maybe 9 months. And then that month, I think we were about to try for IVF. We fell pregnant that month. So it was, to our surprise, but not too surprising. Yeah, it was a great little blessing. Yeah, so pregnancy from the start, had the usual morning sickness, nausea, tiredness, fatigue. Not too bad. I'd probably say it was quite good in comparison to other people that have really severe pregnancies. But yeah, even right up to the birth, it was quite smooth sailing. Obviously, hearing that my baby was Breech around that 28-week mark, it was quite scary still. Just, I guess, all the outside noise coming into me. I had to get, all of that out of my head. And my private midwife was a great advocate for me to, bring me back down to myself and really believe in what is true to myself and my body, and true to me believe I can do this. And even if it's Breech, it doesn't matter. Like it's a normal birth.
And at what point with your journey, because you've mentioned how you had a few different care providers, so what had you decided at the beginning where you wanted to birth? And maybe just talk us through that journey of finding that first care provider and the transition to the next one.
Yeah. So the first one, this was after obviously all the research that I'd done. I was like, I'm going to be doing a home birth. Like I really want a home birth. Like I hate hospitals. I have a history of Graves' hypothyroidism. So I was in and out of hospital all my life as a teenager, which, I guess I had a negative side to the hospitals and just never really liked that clinical environment. And I'm very holistic in how I live and, no chemicals sort of thing. So it's, I just didn't really feel like that was the best environment for us. So finding that midwife, I think I'm not too sure how I found them. But it just didn't really align with me, way of practice, because it wasn't in the home. You had to go to them all the time. So it wasn't that private experience that you kind of want. And then the next private group practice, it was kind of like, it was out of the hospital, because I think at that stage, my doubts of who do I find if my baby's Breech, like I think probably more likely if I'm not classified as high risk, if my baby's not Breech, well then I'll want to give birth somewhere like a private group practice. Yeah, I wasn't too sure. I was probably a bit naive at that stage. I wasn't too sure if that was like the MGP program, if there was like a different room, or if it was like I give birth there, but still wanted to have that option of home birth in the back of my head as well, going through them. And then, I think I had, 3 appointments with the midwife that I was assigned with. Just every appointment, I was just trying to get more and more out of her, and if she would be comfortable with delivering a Breech baby. And she would have to put me to the obstetrician at the hospital if baby was Breech. And then that goes out the window, the care that I would wanted from one person. I didn't want multiple people surrounding me and just not knowing my story and believing in me, I guess. And then I think 3 months I was doing more research and I was like, no, there's got to be more options. And that's when I think we watched the Born at Home film, I'm pretty sure, around that similar time. And then we had a referral it was an Instagram post for this specific midwife, who statistically trains in Breech delivery. And I think I left it a couple of weeks, but I was like, no, I know this person is probably going to be our make or break for a Breech birth at home. And we reached out to her and just felt so comfortable straight away. And I just knew that this midwife was going to give us the birth that I'd wanted.
Did you say there was a private obstetrician amongst there as well?
Yeah. So private obstetrician, I think that was just before we found the private midwife, So after the midwife group practice.
So you had an appointment with them?
Yeah, so I booked one appointment with him, and so it was just in and out. I think I knew straight away, I was like, he would not give me the birth that I want. Healthy mum and healthy baby. Just to me, it just in that appointment was like, I'm just going to be stuck in a cesarean route even if I didn't need to. And I just knew he wasn't properly trained, I guess, in delivering a Breech baby. And then we found out midwife. So that was, a couple of weeks in between. And then, so it was a bit further along the journey that we had found our midwife. But I think going through all that just really cemented what we found always meant to be, and it all aligned. So,
Yeah, great. Beautiful. Yeah. I'm curious, I've just been asking others who have a bicornuate uterus, do you know what side your baby developed on in your uterus?
Yeah. So I think she was on the left, pretty sure. Yeah, now it's been so long. Yeah, so the left. Yeah, so I didn't feel her move from the whole, I guess, maybe 20-week mark from that side on. I don't think our gynecologist, when he found it, I don't think he told us if it was attached or not. He just said there was a septum there, and the photo was very obvious that it was all the way down. But then I think she did keep moving side to side sometimes, but it was just staying in that one breech position, which was, interesting.
She made room for herself.
Yeah, she did. Yeah.
Yeah. Beautiful. So talk us through that last phase of pregnancy and how you felt in the lead up, knowing that you're having a planned breech birth.
Yeah. I think it didn't take me too long to, I guess, realise that this was going to be the way I birthed my baby. Obviously, there was a lot of things I had to work through mentally, and knowing that this is a safe and normal birth, it's just a variation of birth. And I like doing things differently anyway. So I think I just blocked out all the noise, and my midwife definitely helped me with that. But I was just kind of going into myself and really, I guess, doing all the meditations and really taking time for myself and not listening to anything, not reading, doing research, not Googling anything, which really helped. And I find I am a big Googler and researcher, and it's hard to not do that. But I think just surrendering into this pregnancy, last phase of pregnancy, it was really like a beautiful time, something that I hadn't really done before, and I'm gonna get emotional. It was just a really beautiful time for me to connect with my baby. So
Yeah. Did you have any ultrasounds towards the end of pregnancy to check the breech position?
No. So I think I stopped getting ultrasounds maybe around that 28-week mark. It was just the last ultrasound was a fun one, so just checking where baby is, but we stopped getting ultrasounds from that 28-week mark just because I didn't want to know. I just was like, no, I know this is going to happen anyway, she comes out. So we didn't opt to get any more ultrasounds, which was, I guess, very relieving as well, because I didn't have another stress that, if I'd found she was sitting a different way, like if it would be possible for me to birth my baby. So we didn't opt for that.
Yeah.
Yeah.
And so how did labour start? What did that look like? Did your waters break first? Did you start contracting?
So we had our midwife appointment the day before she was born, and obviously being that 41 and 5 coming up to 42-week mark, they did opt for us to, if we wanted to try and induce labour, I didn't want to get any stretch and sweeps or anything like that. I was happy to try evening primrose. So I tried that. I had to take it orally, and then I also take it vaginally as well. And I think within maybe 20 minutes after that, I think that's when the contractions started. And from then it kind of kicked off quite fast. I felt, I don't know what a normal start is. I wasn't timing anything at all. So don't have much correlation of time frames, but they did feel like quite close together, maybe within that 5 to 10-minute mark. And then labour just kept progressing. I felt like I was in so much pain. Just with, it was just a weird feeling, I guess, something that you haven't experienced before. My biggest tool that I used in labour was the birth sling and the TENS machine. We found out baby was sitting posterior. I don't know how far in between or when we found out that. But the TENS machine was great. And every time I got into the pool, it just wasn't conducive. It just wasn't working for me. So obviously all that back labour, my midwife had to keep pressing, doing pressure points, and it was working. The pressure points were great, but I just felt like it wasn't helping anything flow. It was just kind of stagnant. And I kept using Sam to hold on him, or the birth sling, pulling on that. I also used the holes.
Spiky balls,
Yeah, they were great. And like I said, in and out of the pool, but not really working. And people keep coming, I think labour stalled a little bit because we did have our photographer in there as well, and the two midwives and Sam. So it was just a bit too much for me. Waters hadn't broken. I believe they broke. I think I got into the pool, and before that, I think I was sitting on the toilet and I was pushing something out, and my midwife said, "Reach down and feel what was there." And I was like, "Oh no, is this the baby?" Like I just had no idea what to expect. But it was my my sack, bag of waters, and because I thought it was her head, I was like, "Hang on a minute, isn't she Breech?" So it was like, okay, she's just turned. But anyway, so I kept pushing on the toilet. So the toilet was a great tool. I was sitting backwards, and I had my knees up or feet up so I could squat down and push. Kept pushing, had to get off the toilet, and then I got into a squat. I was pushing more, And then I pushed out the bag of waters. So the bag of waters was just hanging there, which was quite weird. Like I had no idea. Again, I couldn't see it from the outside perspective. So I just had no idea what was going on or what was happening. The midwife, she said, let's hop in the pool. And it did. So that's when my waters broke in the pool. I'm not too sure how long it was. Could have been 4 or 5, maybe 6 hours in. I'm not too sure. And then that's when things slowed down a little bit. Probably being in the water too. Also having a lot of people in the room. I just kept saying, like, it's just not working. And yeah, she's, I think we gave it a little bit of a break from there. She kept coming down, but she just wasn't turning properly inside. So she was still posterior. I just felt like nothing was working. So then I think we got out of the pool and baby wasn't turning as we had liked. I was still getting that posterior labour pain in the back. And we didn't feel like she was moving or progressing any further. So our midwife reached around. Midwives were trained in Breech also to see what we can do to turn baby. So we had to do I say we, but I guess it's we, Ayla and I. I had to do some, quite, I guess, fun exercises. I don't know what you would say. During contractions, they were the one that I remember was laying on my back, edge of the bed with my knees open, middle of contraction. And I believe that's when, I don't know if the second midwife had done anything to my belly to maybe help turn at all. I can't really remember that stage, but I do remember the feeling of baby turning a little bit. I could feel her turning inside of me. And the second midwife was saying that, yes, she could see that baby had turned, not knowing how much, but it did feel like I was progressing a bit further. I think after that, I was exhausted. It was a 17-hour labour, so it was an overnight as well, so we hadn't had any sleep. It was quite, a long one, so that's why it's hard to remember, I guess. I think a midwife offered me some pain relief just to give me a bit of a break and, a rest in between contractions because I felt like I was getting nowhere and I was exhausted and I wasn't really eating much food, drinking much water, I felt. So I was just physically exhausted. As much to my, I didn't really want to take any medications. I wanted to be holistic as possible. I just knew that was probably, it was going to help me no matter what. So I think I was getting a bit of sleep in between contractions. It felt like they were back to back even when I was getting sleep. So it was probably really beneficial to have the medication. I think after a while doing that, still me saying like, I just not working. I'm so tired. I just need to sleep. And then, then I had the urge to push. I think I had the urge a while before, but it just wasn't working. I think that when I got into the pool around that time, it just wasn't working. It just didn't feel like it was working. And then I was putting a time limit on myself as well. I'm saying like, she's not coming, like it's not happening, like why isn't she coming? And I was just getting all in my head. And I think my midwife just grounded me. Said like, this is going to work. You just got to give yourself time and your baby time. I was going through that crisis of confidence. And I didn't want to go to hospital, obviously, but I was like, no, get me to hospital. My second midwife just turns around to me and says, honey, this is labour. This hurts. You can't really escape it now. And I was like, why isn't anybody giving me what I want? So that was really hard to hear, I guess. I just felt like a child again, just getting told off. And then, going back to that urge to push after the medication and the bit of breaks that we had, I just kept getting off the bed. I just felt like that urge to squat. Didn't really know which position was comfortable for me. I did try, I think, one leg up and kneeling. The squatting really helped me. And then I could feel something coming out and it was quite bony. It was quite hard. And that was her foot coming down. It did say she came out complete breech, so her feet came out first, well, one foot and then the other. And then she was also posterior when she came out. The midwives put a mirror underneath me so I could see her little toes, and it was quite weird to see, like little beans hanging out. But I just knew that was
peas in a pod.
Yeah, literally. Yeah, it was really wild. And I just knew that there was no turning back. And I think I was getting a little bit, not hysterical, I guess, upset, because I was like, this is happening. I'm about to birth my baby at home, a breech, and just everything was coming back to me. I was told that I wouldn't be able to birth my baby at home. No one else believed in me. But it was just, I think all this emotion was coming to me. And my midwife was behind me and she had to do a manual rotation. because baby was, they could see her body was going white from, I think it was her belly up to her head.
And was she still posterior at this point?
Yeah, so still posterior. Yeah. Her, the reason why she was going white, her cord was compressed against my vaginal walls. They had to work quickly, and she did the manual rotation just to get baby from back to front. That was probably the most excruciating part of the labour, I've got to say.
Mm-hmm.
Just did not expect it at all, but I think whatever they had to do to get her out. And then I think they had to do a shoulder press as well. I think it was shoulder dystocia they were concerned about maybe as well.
If it's shoulder press, usually the shoulders are birthed and just the head's inside. So then they push the chest or on each shoulder to then flex the head.
Okay. Yeah. So
does that sound right?
I think so.
Yeah. Yeah.
So shoulder press for the head to come out. So the head was deflexed. Is that right?
Yeah. Yes. If your perineum is empty, that means the head is deflexed.
So and then, she did a push, and then midwife passed baby under me. It was quite a surreal experience seeing my baby because she was quite limp and white and blue, and it was just quite distressing to see, not something that I expected. When I saw her, I was just like, I was still super exhausted and fatigued and didn't really know what was going on, I guess, in that whole birth state. Yeah, so my midwives were super calm. I guess they're calm presence just kind of made me calm and didn't stress me out at all because they knew exactly what to do. Gave her a little bit of oxygen. They acted so quickly with the oxygen and us just talking to baby, reassuring us that she was safe, and hearing our voices, I guess, helped her transition into the world a bit easier, as much as it can be coming out like that. But it was probably something that I hadn't prepared myself for.
Once Bub was breathing and doing her thing, did you get some skin to skin? Did you move from where you were? So you had been squatting or on your knees?
So I think I was squatting, and then I got onto my knee, like laying over baby, just stroking her. She was wrapped up in a towel. So I don't know how long after that, we got up and had some skin to skin on the bed. It was quite a long time. I felt like maybe over an hour or maybe 2 hours. I can't remember.
Yeah.
I think by the stage, midwife said that we should probably get things moving with the placenta because it still hadn't come out yet. Another one of the medications that I had was actually the Syntocinon. It was for the placenta because it still hadn't come out. So I had to get the Syntocinon injection. Yeah, I really didn't want it, but I think we just needed things to keep moving.
Do you know how much time it had been by the time you got that?
It felt like an hour and a half, but I don't know if it was a lot longer. Maybe coming up to that 2 hour mark, potentially. Yeah, I can't recall that. Birth world, can't really remember anything. And then I think we just kept having skin to skin. Midwives were out doing their thing. They left Sam and I on the bed to just, be a family. And it was such a beautiful time just being at home in our own environment with our baby that we just birthed at home. It was just so surreal.
So you birthed your placenta and did we get to breastfeed in the beginning? What did that look like?
Yeah, so we did put her on the breast straight away. So she latched quite perfectly. That was up before the placenta released. I had to come out of bed. I was still holding baby while I was trying to squat the placenta out, but it just wasn't working. So I passed baby to Sam while the placenta was still in me. And so I think for me, it was like, I just didn't really want to give anyone Isla, my baby. I just felt like I was so connected with her already. I just didn't want to let her go. But I mean, I passed her to Sam, so it wasn't too bad.
You'll share with Sam.
Yeah, I will. Fine. So took a bit to get the placenta out. I have to do a few coughs, like squatting over a bowl to try and get it out. I can't remember if the midwife did a little bit of a pull or if it just came out. But it all came out intact. And we also wanted to get the placenta encapsulated as well. So we had to organise for the lady to come pick that up.
Mm-hmm.
And then, again, I don't know timeframes. Midwives were still out doing their own thing, popping in every so often, I think.
Yeah, beautiful. And so you had that time at home. Were there any issues with breastfeeding or postpartum for you?
Postpartum was not to mention also I did have to get stitched up a little bit. I think it was a first or second degree tear and then just a couple of grazes, I believe, but nothing too serious to have to go to hospital.
And bleeding was okay?
Yeah, bleeding was pretty good. I think the day after I gave birth, I was having some severe cramping. I had a bit of retained placenta, but I think it was retained membranes.
Okay.
So that was after the placenta came out, I believe. Midwives were trying, I think it was within like 4 hours. It was just hanging there. It hadn't come out yet. So midwives tried everything. I think that's when I had the syntocinon after the 4-hour mark of the membranes.
Oh, okay. So you birthed the placenta and then had the syntocinon after to help release the membranes. Okay.
So yeah, they were trying everything. I had some like little forceps that was just hanging down in between my legs. So yeah, that was quite uncomfortable having to go to the toilet and that hanging. Yeah, eventually got it out. So after those membranes came out, I was feeling fine. Blood loss was normal. But the next day after I gave birth, I was having some severe cramping and it felt like I was going into labour again. I also had some herbal tinctures through the labour and also took placenta release tincture that I also tried on this night. We called our midwife asking why might I be feeling like this? Why am I getting cramping when I've already had the baby? And she reassured us that it could be the placenta or some of the membranes still stuck in there, and it's just how my body's reacting. It got to the point where I had to call the ambulance. I was just in not a good way. It was kind of worse pain than labour itself. And by the time the ambulance got there, I had taken some Panadol, and I think after 15 minutes it kind of went away, so I wasn't in any pain at all. I still went in for checks and observation, but it was middle of the night, so they didn't have the sonographer there, so we were like, all right, we'll probably just leave it because I was feeling fine. We didn't want to stay in hospital with a 1-day-old, so we just decided to go home, and I felt fine. I didn't have any fevers or anything like that at that stage. And then I think about a week later I noticed that some membranes come out. So it was
a week later.
Yeah.
Wow. Did you have any pain in the lead up to that, or had it just stopped?
No, so it was just the blood loss that I was having, and then the membranes came out in my undies. So I sent a photo to my midwife. I was like, do you reckon this might be some more membranes? And she assured me that yes, it did look like membranes. So yeah, and that was kind of comforting to know that that was probably just how my body was getting rid of everything that was still inside. And due to the biconduit, it was most likely the septum potentially that was containing the membranes that it might not have released properly. And then breastfeeding, I felt like she was feeding normally. I kept not really timing, but trying to time just to see if she was getting enough food into her. I think around that 3 to 4 week mark, our midwife had done all her checks and things weren't looking too great. She'd only gained in that week from 3 to 4, 7 grams a day, so quite on the lower side. And that kind of, I was kicking myself like, why am I not feeding her enough? Like, I'm doing everything. And our midwife just said, like, let's get you straight onto donor breast milk. It was something, again, that I hadn't done my research on because I just knew that I was going to be able to breastfeed, having family members breastfeed all their babies. My mum breastfed. But, it obviously wasn't working for me. But we were still feeding from me, and she was getting top-ups from donor breast milk, which, again, was hard for me to being so health conscious, and was hard to trust other people's milk going into my baby. But she's solely on donor breast milk now. I'm 10 months on.
Yep.
And I guess around that 5-month mark, I stopped offering her my breast. I was exclusively pumping day and night, but just nothing was working. And so that was another hard thing that I had to accept and to surrender to. But we found a great donor who lives the same lifestyle as us. And was just so happy to give this gift that she's been given to feed her baby, to also feed our baby as well, who I think her daughter is actually a week older than Isla. So it was just all meant to be.
That's great. That's great that you had access to that. And did you do anything yourself to try and boost your supply? I'm assuming it had to do with low supply for you.
Yeah. So I tried everything. I think I tried all the herbs, the supplements, pumping, like trying to pump, timing pumps, which was why I exclusively pumped for 5 months. But nothing was working. And I think I kind of came up with the my own diagnosis, I guess. I diagnosed myself with low breast tissue, trying everything. Yeah, and nothing working. I just knew that there was obviously something. And as a teenager, I was diagnosed with Graves' disease or hypothyroidism. It was around that time that, you transition.
So knowing what you know and having the experience that you've had, would you do anything differently with your next pregnancy if you choose to have any more and you have a breech baby?
I think I would probably just, knowing what I know now, not doing as many tests, not doing as many ultrasounds, believing in myself, just, I guess, where I ended up at the end of pregnancy, I think I would want to do that again. So how I was, not researching anything, just believing in myself, trusting in my own intuition. And, just starting from there, starting from scratch. And obviously not having to go through so many different people. We will get the same midwife again, who knows us, who believes in us, still knowing that having a bicornuate uterus, most likely having a breech baby again, and just preparing mentally for that again. But it's my normal now, so I know no difference. So it's going to be completely normal if baby's sitting breech. But yeah, just, I guess, trusting in myself from the start and not even questioning my intuition.
Since having your experience, do you feel empowered by the decision that you made?
That I made? Yeah, 100%. I just know that each and everything that I went through, I know that I stayed true to myself and I knew exactly what I wanted. Yeah, it just made me realize that I knew what I was wanting, and I know that going forward that just, staying true to myself and what I believe, blocking out outside noise, 100%. It did empower me and all the decisions that I did make to help me create the birth that I wanted. Yeah, even with all the doubts and the noise that I received. Yeah,
beautiful. Do you have any resources you would recommend to anyone listening now that's got a breech baby on board or potentially going to have a breech baby if they've got a bicornuate uterus as well?
I think just really the main resource that I used was my own intuition and just believing in myself. The Breech Without Borders didn't really help me. Diving deep into the Breech Without Borders research of, they did state having a bicornuate uterus on their website and that potentially it might not work. So I just kept doing what I was doing, just doing stretching exercises, just to help free up the hips and release everything that might have been tight down there. I did do some internal release work as well here on the Sunshine Coast. That could be another option for anyone.
Did Isla need any support? Sometimes breech babies need a bit of support with chiro osteo. Did she need anything?
Yeah, so she was quite tight and quite stiff when she came out, and she did get some osteo treatment. We did go see an osteo. We found another one here on the Sunshine Coast that came into our house and treated Isla. And from 8 weeks, she treated Isla and still treating her to this day.
Amazing. And lucky last question. Do you have any words of wisdom or advice you'd like to share with anyone listening now?
I think just stay true to yourself and listen to your intuition. What is it telling you? And block out all of the noise and everything you know about having a breech baby. It doesn't have to be end a certain way. It can end in how you desire, as long as you have a practitioner that believes in you as well and that believes that it is safe for you to give birth, because complications can happen with every type of birth. It doesn't have to look a certain way for you if you believe in yourself. I truly believe just blocking out everything, trying to zone in on your own, how you want to birth. Really, that helped me anyway at that last stage of pregnancy, just to believe in myself and my own intuition.
Perfect. Amazing. Thank you so much for coming on and sharing your story. It's been beautiful to listen to.
Thanks for having me, Sasha. It's been an honour.
Thank you for listening to the Breech Birth podcast. These stories matter. They stretch what we think we know and bring voice to experiences that need to be heard. I'm so grateful to the women who have shared their experiences with us, raw, real, and full of wisdom. If this episode resonated with you, please follow, share, or leave a review. You can find us on Instagram, Facebook, and YouTube at Breech Birth Podcast. And if you have a breech story to share, I'd love to hear from you. Until next time, may we continue to reclaim the narrative, one story